Hi, everyone. I'm Benny DeCecca, Chief Executive Officer of Validation Institute, and would like to welcome Nigel Orenstein, who is President of Kaia Health, and Al Lewis, Co-founder and Advisor of the Validation Institute. Welcome, Nigel and Al.
Thank you.
Nice to be on.
To start, I would like to tell everyone a little bit about Validation Institute. Validation Institute vets and validates the performance claims of healthcare companies around savings and outcomes. Our highest level of validation is a program validation, which is when a company conducts a qualified trial and we can validate the savings and outcomes data of an entire product or solution. So we are very excited to have Nigel with us today because Kaia recently was awarded a program validation for their digital musculoskeletal solution. So Nigel, welcome and congratulations to you and everyone at Kaia. I was hoping you could share with everyone how has Kaia been able to achieve these best-in-class outcomes? Basically, what's your secret sauce?
Sure. Great to be with both of you. We appreciate the partnership with the Validation Institute and appreciate what you do in terms of bringing not just validity to companies like Kaia, but a third-party verification to the market, which I think we all agree is broadly needed. For Kaia, clinical excellence has been a key part of our DNA since the beginning. And our perspective is that digital therapeutics should be held to sort of the same standards that you would expect a drug to be held to, that they should go through third-party, verified, randomized clinical trials. And so that's sort of what we set out to do. What's really our secret sauce is, to me, comes down to really two things. One is that, right, a commitment to clinical excellence and a commitment to outcomes, a myopic focus on the patient, and making sure that the patient has a better and superior experience. And then the second, which is unique to Kaia, is the motion analysis technology, right, and the ability to deliver a therapy anywhere, anytime, through the chosen device of the consumer, right, which is the phone or the iPad. I remember in the early days of electronic medical records, people tried to get the doctor to go outside of the EMR, and the doctor just doesn't do it. And so we think the same is true for digital therapeutics.
Well, that's great. And you mentioned clinical excellence, and can you talk a little bit more about why that is so important to your mission?
Sure. I think it comes down to a few factors. The first is we're in healthcare, right? And as healthcare companies, we should all aspire to clinical excellence. We know that, unfortunately, the healthcare system doesn't always deliver clinical excellence, and we know that there's enormous variation, right? And so one of the most amazing things about what Kaia can do, right, is that we can solve, in the case of musculoskeletal pain, we can solve some of healthcare's sort of biggest problems, right? One being access to care, right? The scalability and the ability for people to access our care, whether they are in a rural part of the country, an urban part of the country, and everywhere in between. We solve a health equity problem, right? The camera doesn't deliver a variation in care, whether they're tired or doesn't get tired, doesn't distinguish between wealth or ethnicity. And so we can solve a health equity problem. And the other thing that we can do, which I think is also unique to Kaia, is we're not a threat to the in-person care, and we complement in-person care. And so that enables us to really focus, as I said before, on the patient. And if we do that and deliver clinical excellence, ultimately, my belief is that we'll build a great company.
Well, that's great. And how will the program validation help you stand out? It is such a crowded marketplace out there. So how will this affect you and the company?
As you said, it's a crowded marketplace, and the marketplace is crowded, as you guys know only too well, not just by musculoskeletal companies, but every potential type of healthcare problem or opportunity that our clients are being pinged with, right? Whether it be smoking cessation or diabetes or cancer, cardiovascular, right? The list goes on, right? And that's not just digital health companies. That's services companies, consultants, companies that can help you move to value-based care, and the list goes on, right? And so it's really, really difficult to differentiate yourself and stand out. We're fortunate that we've got a differentiated solution in the motion analysis technology. So that's one aspect of obviously how we stand out. But our second big differentiator is clinical excellence, and your validation is absolutely phenomenal for us, right? It validates. It does actually. Two things that I don't know whether you're actually fully aware of this. The first thing that it does is, as you say, validates us to the market. And even in the short time the press release has been out, the number of comments I've had, the number of calls I've had has been fabulous. And so to the market, that is excellent. And obviously to receive the program validation is enormously heartwarming for us. And obviously being the only digital MSK company to reach that level is a massive differentiator. And as you guys obviously know, only too well, only the second digital health company, which is also incredibly heartwarming. But the second thing it does, which I don't know whether you're aware of this or not, but it's phenomenal internally. And so the years of work that goes on behind the scenes, the clinical work, the work of our health coaches, the work of our engineers, the work of our of everybody that's in the company that has been historically and is now, this brings enormous inner strength that what we're doing is right. And so the work you guys are doing, not only brings validation by to payers and self-insured employers and providers that we have a great solution, but it brings inner strength internally as well. And I'm sure if it's done for us, it's done for other companies as well.
Well, it's amazing to hear. We always hear how it benefits companies going out into the market, but internally hearing that it's just amazing. And the folks there have done a great job and deserve a round of applause. I'm going to turn to Al for a second. Al, you looked at this and you were the one that conducted the validation. What did you see or learn that sets Kaia apart from other digital health companies?
Well, as Nigel mentioned, there's only one, or actually, I guess, two other digital companies that have actually done RCTs, actual RCTs, to basically the standards of essential. I'm exaggerating just a little. The FDA, the idea that the two groups are equivalent. You don't compare participants to non-participants. You don't match participants or use propensity scoring. You actually get two similar groups of people. They both consent. They don't know if they're going to be in the study group or the control group, but you control for both what they look like and their willingness to participate, and you compare the two groups. That's very, very hard to do in the United States. I mean, it's easy, but nobody wants to do it because internally it creates issues within an organization.
And can you talk, since Kaia has gotten this program validation, what makes a program validation different and why is achieving it an important milestone?
Well, it is and this is not to take away anything from the other validated companies in musculoskeletal or elsewhere, but if you read carefully, most of them have an asterisk that says, it could be that some of the difference was due to the difference in mindset between the participants and the non-participants. The degree of asterisks on this validation is very low. It's a high enough level of validation that I, as the co-founder of the Validation Institute, And the CEO and Quizmeister in Chief of Quizify are not yet able to achieve this level for my own organization, Quizify. So we have the savings validation, which is the next one down. But to get to program validation, well, that requires a lot of commitment, a lot of effort, and we haven't even been able to achieve it yet. That's how rare it is.
And how should anyone evaluating an MSK solution interpret this, the importance of this?
Well, every MSK vendor will say that they have a secret sauce. Technically, it's called special sauce. It was this 2 all beef patty special sauce on a sesame seed bun. I run but the difference is that have they tested this special sauce on an actual IRB level randomized control trial? And therein lies the bright line distinction.
That is amazing. Well, thank you, Al and Nigel, for joining me today. And if anyone is looking for more information on Kaia or their validation, please go to validationinstitute.com and download their report for free. Thank you, everyone, and have a great day.
Thank you, Benny. Nigel, good to see you.
Nice to see you both.